Good afternoon, everyone. I'm very happy to welcome you here at those webinars. Zoetis is organizing together in a strong collaboration with Vetworks and Poultry Health Sciences. This is the first one in a row of 9 webinars. And the reason we have to do this is very simple. We're all confronted globally with COVID-19. And COVID-19 is disturbing not only our normal life, but also our normal way of working in the business. And instead of having some face-to-face meetings and trainings, we all have to choose for other ways to communicate with each other. And we all learn step by step, and so do you. And I'm very proud to kick this off, and I would like to give the floor first to my boss, Dr. Gabriel Varga, who is the director of Sub-Saharan Africa. Gabriel, I hope you're able to say something. Go ahead, please.
So as you can see, dear participants, the technology is working with a little bit of delay, but it's working well. And I'm very proud that we have well over 60, and we expect at the end close to 100 participants on this meeting. And also COVID changed a lot in our lives. At the same time, we are having even more opportunities to have good speakers more frequently and more remotely as well for the meetings. I am very proud that we can work with Vetworks, and thanks to Eric and the team around him, also in our alpha countries, to invite all of you. We definitely would like to come back to face-to-face meetings and trainings as soon as we can. At the same time, we see that this kind of ways of interacting, of joining sessions, and having even more flexibility in sessions is improving our communication. So we would really welcome also suggestions from your side. What kind of topics you would like to hear from in the future? What would be the best way to connect? Which time of the day, and so on. So we definitely want to improve this interaction, and I'm glad that we can kick off and start this series of training. So thank you very much for the team to organize it, to put it together, and thank you all for joining the series and this first session. Thank you very much.
Thank you, Gabriel. Floor is yours, Hilde. Please go ahead.
Thank you. So also a very warm welcome from me, from cold Belgium. I, of course, would have rather come to Africa, but it's not possible now. So let's concentrate on the topic of today. Colibacillosis. It will be 3 sessions. I will start today with the disease. Then tomorrow, my colleague Tiago will talk about diagnosis of colibacillosis in the field and in the lab. And then we'll round up on Thursday with control and prevention, where also Zoetis will propose their solutions. So colibacillosis, all of you working in poultry know that this is a very important pathogen, costing us a lot of money. My overview of the presentation is we will first look where do these E. coli come from, so the cause and the epidemiology. Then how does this bacteria make the bird sick, the pathogenesis of the disease. And then we'll have a look at how can you recognize this disease, the clinical symptoms and pathological lesions. So colibacillosis is caused by E. coli. It is an opportunistic bacteria, meaning that it is there and it will take a chance whenever it can to do harm. It's a common pathogen of many animals and also humans. Poultry, swine, cattle, they all have E. coli, and we can exchange these E. coli amongst each other. That's why E. coli is also playing a role in transmission of antimicrobial resistance. So we like to call it a secondary facultative pathogen, mostly because there are also cases where E. coli is the primary pathogen. When will you get the disease? When will the birds get sick? Is you need some predisposing factors. Some of the E. coli are equipped with more virulent factors than other E. coli strains. Then from the outside, any stress will make the birds weaker and will make E. coli, make it more easy for E. coli to manifest. Also immunosuppression. Professor Antonissen will talk about the mycotoxins and also can play a role here. And co-infections. And I'll try to explain, and I'm sure you know that in poultry, there's a lot of pathogens working together for example, in respiratory disease. And those are all the co-infections that can make that E. coli can become a problem. Treatment is a challenge, and that is, well, first of all, we can treat for E. coli, but if we do not find the primary cause, the problem will always start again because E. coli is there. Then sometimes there are a lot of multi-resistant E. coli. So that means we try to treat with an antibiotic, but it's maybe not going to be successful. So what is the economic impact of Colibacillosis? It causes mortality, and you will see in the different diseases that this can be quite severe. Then even if we don't see mortality, it can give us suboptimal performance. It's like a subclinical thing being there, and we will not get the good growth, we will not get as many eggs as we should. Then of course, one cost is treatment, and if you don't make a good plan to fight Colibacillosis, you will treat many times, you will have to repeat treatment, which is not good. So that's why we will end this series of webinars with proposing control and prevention programs. And then another cost is condemnations at slaughter. Sometimes the birds survive with E. coli and they will reach the slaughterhouse, but then inside you see that is not a bird that we can eat because there's a lot of inflammation there. I will not trouble you too much with a lot of families of bacteria, but it's important to know that it's a gram-negative, that it is quite easy to grow in the lab, but Tiago will talk about that tomorrow. It's the cause of what we call coliform syndrome. That means that the same bacteria can cause different types of diseases, depending on the age of the bird, depending if it's a layer or a broiler. And usually, there are other pathogens that are involved. Where do they come from? These E. coli, they are normal inhabitants of the intestinal tract. So, and as long as they stay there, it's not really a problem in poultry. Not only is it, so they are inside the guts, that means that they will be excreted in the farm, but also other E. coli from the environment can come inside the houses and be transferred on the outside of the eggs. If a bird lays an egg, first of all, it can be contaminated by intestinal contents. And also once it falls in the nest or on the egg belt, it can get E. coli from the environment, from dust. And moreover, when the egg is laid, it's about 40 degrees inside the bird, and then it will cool down because outside it will usually be less than 40 degrees. And what happens is that in the process of cooling down, E. coli can be sucked inside through the eggshell. And so you can find it on the eggshell, but also inside the egg. Classification, what I want you to remember here is that we use the Kaufman-White schemes, classification, and the most important, you have different antigens there, but the most important here for E. coli is the O antigen. So where that you find on the outer membrane. If this is E. coli, then you will find it. This is your O antigen. And some serotypes have been associated with to be pathogenic, and we used to call them APEC, avian pathogenic E. coli. And one of the serotypes that was very prevalent is the O78. In mammals, E. coli is an enteric disease, like in swine, in calves. In birds, they are in the intestine, but the ones causing disease are the ones that become systemic or that provoke localized disease. So we used to call them avian pathogenic E. coli. Now we call them extra-intestinal pathogenic E. coli, because it's the ones that are in other parts of the body and not inside the gut. So these strains are, well, characterized by a serotype, so O78, O2, O1, and also sometimes in classifications you can see that other serotypes are not one of these. So this is one way of classification, and then the fact that they are pathogenic is linked to virulence genes. On these specific pathogenic E. coli strain, we will find pathogenicity islands, and they will, if they come to expression, these genes, then you have a very virulent strain. What we also see is that the more virulent strain are more linked to multi-drug resistance. It's the ones that are not killed when we do a treatment with antibiotic that are resistant that will remain. So we also have commensal strains of E. coli. That means that sometimes the same type of E. coli strain belonging to the same family, phylogroup, you can isolate from healthy birds and diseased birds. The ones that are not going to cause disease are low pathogenic. We call them commensals. And the thing is that it will also depend on the environment, on other factors, if we have disease or not. This is a slide to show you the serotyping. We have here, this is from 2011, and there is an evolution there, but what I want to show here is that you have E. coli in layers, in broilers, in breeders, and that the most prevalent serotype in 2011 was O78, whereas we see an evolution that other serotypes are recently becoming more prevalent. So that was etiology and epidemiology, and where do they come from? And let's see how can E. coli make the poultry sick. To start with, a really healthy bird is quite resistant to E. coli. If the immune system is adequate, if the bird is in good condition, if the environment is fine, the climate, etc., then E. coli can be there and not make the bird sick. But very often, there is something else happening. For example, we give a vaccination for Newcastle or for infectious bronchitis. We also have mycoplasma there. And what we see then afterwards is that we get a heavy vaccine reaction or respiratory disease. What we know is that Mycoplasma will, and also some other viruses, they will make the ciliostasis, which means that the normal defense in the trachea that's supposed to eliminate pathogens, like when you cough, for example, is not properly functioning. And that is when E. coli will have a chance to become systemic, because very often E. coli is coming inside the body by the respiratory tract, and it will start to cause more damage to the respiratory lining. Another thing that can be a contributing factor is bad ventilation. If you have a lot of ammonia, also your trachea will be irritated and will not have the normal defense that we need to fight respiratory diseases. Anything that will weaken the immune system will also contribute to colibacillosis. Another thing is that, as for many diseases, but we know that from some trials with colibacillosis, is that young birds in the first 1 to 2 weeks, they are more susceptible. So their defense mechanisms are not mature, so they will easily get infected. And they will also, if they are infected later, the disease will not be so bad. They can still get a disease, like at an older age. If you get colibacillosis in a broiler at 4 or 5 weeks, okay, maybe you will have slight respiratory signs or even not, but it might end up with, or the birds will recover completely, or you will see contaminations in the slaughterhouse. Another typical thing of E. coli, I think those who go in the fields and open some birds will have seen this, where you have, this is the heart and this is the liver, where you have a lot of exudate on the liver, inside the pericard, and that is something typical for E. coli. They give a very immediate and heavy inflammatory response. What happens is that this E. coli is going to produce some toxins, and then a reaction comes in the body. The capillaries, the blood vessels are going to be more open, and that of course will make it even more easy for E. coli to enter. And you get a swelling, the reaction, an inflammatory reaction, where the membranes inside the abdomen and the thorax, they will start to swell, and you will get this like a big slimy cover of all the organs. How is E. coli transmitted? I will show you that there is a build-up inside the house with the age of the bird, because there's always more dust, more litter building up. And then at one stage you get, after around 3 weeks, there's like an exponential growth of the number of E. coli in the house. And all that dust can be inhalated. So that is how E. coli can be transmitted. There is contact with the birds, and they will have contact with feces, but it can also be introduced by people, by litter, so new strains can also develop in the flock. And then we have, if you have free range or your house is not bird proof, it can also be transmitted by other birds. As I said, contamination of the egg surface, fecal, and also from the environment, the dust where the egg will travel, from the nest even to where it's collected. And so when the eggs cool down, then the E. coli is sucked inside the egg. I wanted to show this slide because this is from a study from Belgian people, the group from Ilvo, Koen de Reu, and they made a study of the Shell contamination of the eggs in different housing systems. What you see here is like a enriched cage in this case, but like a classical cage, like in Africa most people use. Here, the contamination, because once the egg is laid, it will roll on the egg belt. In fact, the chances of, or the risk of surface contamination is lower in this system than this. These are, these are now floor eggs in a barn system, but the chances that you get contamination are higher in a barn system than in a classical cage system. So this is the slide that I was talking about, where you can see you have in the below, you have the age in weeks of the broilers, and then here you have the number of coliform forming units of E. coli in the air in the house. So as long as the birds are small, they provoke less dust, and it's a build-up of litter, of feed, dust, feathers, of course. And here at this stage, you see that there is like an exponential growth of the number of E. coli in the house, which will be different in winter than in summer. But in any case, this is the period where you have a lot of E. coli in the house. And that's why we say, try to do your vaccinations for respiratory disease before that period. Then the risk of getting vaccine reaction with secondary infection with E. coli will be much less. So let's have a look at the clinical symptoms and the pathological lesions of colibacillosis in the different forms. As I said, E. coli is one bacteria, but it has many faces. It can provoke very different types of disease in different categories, layers, breeders, broilers, small chicks, older birds. So the main diseases that, when we talk about colibacillosis, the first thing will be that people think about neonatal infections, which can be, as we explained, on the egg, in the egg. So the infection can already be there before hatch or after hatch. If it's before hatch, depending on the pathogenicity, it can kill your embryo. So that means you will not have a chick. Or if it's after hatch, it will be omphalitis, mortality, septicemia in the first week. Then another syndrome, colibacillosis, is respiratory infections that we can see in broilers, but also in other birds, that we call CRD, chronic respiratory disease, although we can also have some acute forms of this disease. And then in laying, the third colibacillosis syndrome is in laying birds, where E. coli is going to have provoke an infection of the reproductive tract, and that is what we call egg peritonitis. This can be ascending from the cloaca up to the reproductive tract, or it can also be systemic. There can be E. coli that are entering by the aerogenic way, that are inhaled, and that can then become systemic, and in that way affect the reproductive tract. So these are the main syndromes, and then we also like to classify, or we see that E. coli can provoke infections that are localized and other infections that are more generalized. So, or it's just one organ, or it is something that goes to the whole body. And we have acute E. coli infections that can give, depending on the virulence of this E. coli, can be with high mortality. And then we have some chronic forms, and those are also going to have an impact on egg production, egg weight, so performance will definitely be affected. Looking at the localized infections. We will start with omphalitis, then cellulitis, swollen head syndrome, and egg peritonitis. And then the generalized infections are coli granulomatosis, which is something that is not so common, and it's also not going to affect a lot of birds in a flock. I'll show you some pictures of that. Then we have cholisepticemia in respiratory or in the layers, and acute peritonitis can also even kill birds. Then we have some, but I will not go into much detail about these sequela, which are meaning that after you have a cholisepsis, if the birds recover, you will get some signs or disease, like you can have the E. coli that travels to the brain, where you get meningitis. Sometimes it can be affecting the eyes, where you get, if you look at the eye, it's like an abscess inside the eye, which is an E. coli after recovering that is localized there. And sometimes we also find E. coli involved in osteomyelitis, in arthritis, and synovitis. Okay, we're going to have, because the reason why I want to show you, or we're talking about E. coli, is because we want you to identify this disease in the field. We are very lucky in poultry that we can rely a lot on necropsy. I think in other species that is not so much the case. So I want to show you a lot of pictures so that when you're in the field, you open the birds, that you can already start thinking, okay, maybe we have Colibacillosis here. So let's look at the small chick, omphalitis, so infection of the navel, and also the yolk sac, because why do we get this? Sometimes it's because in the hatchery, the navel was not really closed and dry, and there can be an infection in the hatchery, cross-contamination in the hatchery of E. coli, because E. coli can travel on the surface of the egg, inside the egg. So very often we find a connection with the breeder hens. The strains that we find there are connected to the ones that we find in the chicks. So sometimes the embryo will be killed by this infection. Sometimes the chick will survive. And what we have to keep in mind is that that yolk sac, that little backpack that the chicks have to, after hatch, to survive until they can find feed, is very rich in nutrients. Imagine, the yolk is where a whole chicken is born from. So it's very rich in nutrients, but also that means rich in nutrients for E. coli. It's also very rich in maternal antibodies. So if you have an infection there, it will compromise the immunity for other diseases also. So if you have a very high virulent strain, it will cause embryo death, so the no hatch. If it's lower in virulence, it can give you retained yolk sac for a long time. And that is something that we very often see. If you have, in the first week, mortality is one of the reasons, will very often be omphalitis. So we see an inflamed navel, we see chicks that are not active. And that means not active, they are feverish, they will not go and eat, they will not go drink. And that will result in a couple of days in uneven flocks. Also, there is a difference in resorption of the yolk sac, so there will also be an immune status that is not even in all the chicks. And a lot of the chicks that are affected, they will dehydrate because they don't eat, they don't drink, and that can be a reason for mortality in the first week. So here we see a picture of, this is an embryo that it will never hatch. it was fecal contamination of the egg, whereas here you see there's an inflammation of the navel, and this is an infection after hatch. So what you see, these pictures are from Professor Mieke Matthijs. She made her PhD on Colibacillosis. So you see here, this is a 3-day-old chick. So normally the yolk sac should be less big, should be smaller. And also what you see here is all these blood vessels. So there's a lot of inflammation here. For a 3-day-old chick, this is not normal. I always advise to check your chick quality. And if you find a lot of birds with a navel that is not completely closed, that is wet, that has things protruding, you must complain to the hatchery, because they should have taken those birds out, or they should have left them longer to dry. And this is the clinical picture you have very often. First week mortality, open up those birds and have a look what you find there. And here clearly we see that the navels are very much inflamed, red, swollen. Another localized infection is cellulitis. Cellulitis means that you have an inflammation under the skin. It's not always E. coli, but E. coli can definitely be found in many cases, because you can also have Clostridia doing that, Staphylococcus, other Pastorella, Pseudomonas. But E. coli can also do that. And in fact, it's the bacteria from the environment that will penetrate through small traumas in the skin. And then you get, as we remember, I said E. coli is the more virulent strains. They will really cause a lot of inflammation. And so in a couple of hours, you get that E. coli that is traveling around and growing under the skin. It happens and then extending to deeper tissues, but it can also stay just under the skin. Very often we see this kind of pathology after thinning. Thinning is something that we do, which is a very bad habit, but it's when birds, if we are in a flock of broilers, we will take out 15% at 35 days to make more room in the house. Also, there's a market for that lighter bird. And then we will slaughter the rest of the flock at 40 or 42 days. But whilst you thin, this is, you come in the house with trucks and the birds are disturbed, they can be damaged, the skin can be damaged in the catching, and also after, sometimes also when birds crawl over each other to get to the feeders. Too dry a litter here is a disadvantage, in the sense that when there's a little bit of wet litter, then the birds will have some fecal material on their nails, and the nail becomes less sharp. As I said, this process of growing under the skin of the E. coli infection is going very fast, 2-3 hours. Very often you don't see a lot, and it will only be no mortality. You will only see that at the processing plant. So for example, here you can see on the thighs, so this is an infection with E. coli under and on the skin. And here you see under the skin of the breast, also between around the hip, just next to the insides of the thighs, you also can find these, it's like a mass of fibrin. So of course you will not eat that bird. Another localized infection is swollen head syndrome. In this bird, you can clearly see why we call that swollen head. So it's an acute inflammation of bones in the head and the sinuses. Again, this typically for E. coli, big swellings. And very often this is secondary to avian metapneumovirus. So you have the virus first that enters, and then E. coli takes a chance to make big damage on these birds. You can also find otitis, so ear infections in this case, and edema of the sinuses, where you can see that the bird has around the eyes, but everywhere the head is very swollen. Other clinical symptoms of swollen head is opisthotonus, because here the brain is affected, and the birds will start having brain damage and incoordination for that. Here also severe depression, abnormal head position, and this is a picture from Professor Hafez, where you see the sinuses above the eyes that are very swollen. At necropsy, what you can see is here in this picture, we remove the skin, and then you can see that on the skull, you have this slimy exudate. This is also because of swollen head. And in the pneumatic bones, you know that in the skull, there are some bones that have a lot of air, and this is where this E. coli is going to proliferate. Okay, that was some localized infection, more upper respiratory, and then the omphalitis, but we also have local infections of the reproductive tract that can start with salpingitis, which is an infection of the oviduct, and then it can become more severe and propagate, and it can become a generalized peritonitis. So ascending from the cloaca or translocation from the respiratory tract or even the intestinal tract. As I said, in the intestines, they can be a normal inhabitant, but once they can become systemic, then you have the XPEC, so the extraintestinal, and that is when they can cause disease. So we have inflamed reproductive tract, and in the end, you get these. I think most of you vets that go in the field have certainly in laying birds, you see in almost every flock, you can have some of these cases where there's a lot of exudate. In fact, the yolk falls into the abdomen. Even sometimes inside the oviduct, you have crushed shells, and it all becomes a big mass of pus exudate. So it's a major cause of mortality in all kinds of laying birds, so also in the breeder flocks. So here's some pictures to show you what you see here is a very inflamed ovary with peritonitis, because you see these, that exudate is going to affect the rest of the abdomen, of course. Here you see those, purulent pus amongst all the abdominal organs. And here you have perihepatitis, you have pericarditis. So the whole, all the organs are connected with the peritoneum, so they can all become affected. This is a more chronic case where you see, so this is the oviduct full of this mass of exudate. And I just want to take a little sidestep here, and we mostly presume this is E. coli. But in this publication it's a Danish study, where they saw that these kind of peritonitis cases, also, well, acute and chronic, first reason, or in prevalence, it will be E. coli, but the second one is Colibacterium annatis. And I want to mention this because the treatment for E. coli and Colibacterium annatis, they give the same symptoms. Also Pastorella can give something like this. But they have a very different antibiotic sensitivity. So the antibiotic that works for E. coli will probably not work for annatis. That's why I like to say that you must make or try to make a differentiation here. Another infection is ascending. This is what the ureters that you see, also filled with infected with E. coli. Okay, those were all more localized infections. Then we will talk about the more generalized infections. Jarre's disease, as I said, coli is what you see. It looks a little bit like Marek or leukosis, but it is, yeah, the granulomas. When you cut it open, you can see they're laminated. So you find these growths on the whole tract of on the whole intestinal tract. Also in the liver, the peritoneum, mesenterium is showing these tumor-like granulomas. But this is a sporadic finding. In a flock, you will only find a few birds with this, even maybe just one. It's a casual finding. This one is much more severe and much more common, is cholisepticemia in broilers, what we call CRD, or the Colibacillosis with cholisepticemia in young birds. So this is a combination of highly virulent E. coli strains and a weak immune system. And in that way, depending on the age, but also on the virulence of the E. coli, the broiler will not have enough immune response, and you will get a systemic infection. This can be acute, where you, in the broiler flock, you can have up to 10% mortality because of this colibacillosis. Or it can be more chronic or take more time, and then sometimes you see some cases of arthritis, some polyserositis, or even you will only see it at the slaughterhouse condemnations. So E. coli, it's a combination of E. coli, and usually there is another pathogen behind. And that's important for you to find it. In your diagnosis, you have to make a broad spectrum of possible pathogens and examine what can be the cause. So the infection route is the respiratory tract. So first, the air sacs are infected. Dust with E. coli enters the air sacs. Damaged by a virus or mycoplasma, and that is when E. coli will have a chance to become very infective. Also, other pathogens, but the fact that triggers are around. You have ammonia, you have all these viruses that can cause disease, but also when we vaccinate, very often we see a vaccine reaction complicated by E. coli after vaccination for Newcastle or infectious bronchitis. And age is important. Younger than 2 weeks, much more severe signs than older birds. Colibacillosis in the respiratory tract is multifactorial. And that's important to realize, because it will not, if you only treat E. coli, you will not solve your problem. So you have to look at the whole picture. It's we like to call holistic approach. So you look at climate in the house, you look at litter, you look at vaccination program, you look at other infections. In that way, you can attack colibacillosis. So the clinical signs will also a little bit depend on what is the other primary agent. Is it infectious bronchitis? Is it mycoplasma? So that the clinical picture will be different. But very often it looks, once the E. coli, the secondary infection is there, it looks very much the same. So if you did not catch the signs of the first infection, you will have to try afterwards with specific diagnostic tools to see what else, what other pathogens are involved here. But it starts respiratory, upper respiratory signs and conjunctivitis, some discharge. You might hear some respiratory noises, cough, sneezing. And they have fever, so that means they are sitting down. They are very apathic. They don't want to go and eat. They lose appetite. If we look at the lesions, you can see different kinds of lesions, but starting from the upper respiratory tract, inflammation of the trachea, for example, the air sacs, and then also in a later stage, you get polycirrhosis, when all the organs start to be covered with this exudate. I will show some pictures because if you want to be successful in treating colibacillosis, you need to catch it in the first stages. Once it's become those big packs of slime, those ones you will not cure. So you need to catch them, and that's why I like to show you these pictures. It's also from Mieke Matthijs, where you see here, this is the start. That's why farmers have to be very attentive when they go and look at their birds. What you see here is that some swelling on the eyelids, some exudate here. Remember, they can't use a handkerchief, so they have to rub. That's also why you will see the feathers will become dirty when you have respiratory disease. You see the nose here has some discharge. A nose of a chicken should always be perfectly clean. If you see something like that, there is something wrong. Here also you see some conjunctivitis. This third eyelid is protruding too much. And here I want to show you the evolution when you do necropsies, that you can really attentively look at the lesions in the air sacs. We normally say that a clean air sac is a clean window, just cleaned. If you cannot really see through it, then there is something wrong. So this one is, well, almost all right. It's quite clear. And you can also see the lung behind, the pink here. Yeah, so here's your air sac. And this is the start, where you can see slight edema. That's why your air sac is not so clear, because there's edema of the air sac. And you see some small lesions. And you can also, one of the first signs is also that you see air bubbles, foam. There shouldn't be any bubbles inside a clean air sac. If you see that, it means that there is some bacteria making that makes these bubbles. Here then you can see that it's becoming more thick, the exudate, and at this stage is too late to treat. So if you catch it at the start, like here, then you have a chance. But if you let it become too thick, then your antibiotic is not going to be able to reach the organs and cure. So these will be, so, and this is the end. This is a dead bird where you see perihepatitis around the liver, where you see the heart sac full of exudate, and also between the organs. Okay, respiratory syndromes. Now let's have a look at the cholesepticemia in layers, very similar to what we said for salpingitis. The difference here is that you get a systemic infection where you can get acute mortality. When do we see this most? Is when the birds are going to the peak of lay, where you have stress from hormonal changes, and in fact also the birds are they start laying eggs before they are completely mature. So in that stage we can get sudden deaths, sometimes high mortality depending on also other infections that are there. But here you can have a primary infection with E. coli. Another reason why in some flocks you get more of these cases is because they have been put in lay too early. So you can stimulate the start of the lay with putting more light. If you do that too early, then the reproductive tract didn't get a chance to mature fully, and you will get more of this egg peritonitis. So as I said, you can have primary E. coli infections doing this, but also in combination with other pathogens, like infectious bronchitis, like mycoplasma that also can be involved. Often there is an association with the farm, the house. That means that these E. coli are in the environment, and that they will survive between flocks. So on the diagnosis, I'm not going to go too far in depth in that because there's a whole webinar on that tomorrow. But you have to keep in mind that it can be a combination of E. coli strains responsible for a clinical picture. That looking at the lesions, as we did, can give you a strong indication that E. coli is involved. But you have to make your differential diagnosis very broad. And that is what Tiago is going to explain tomorrow. The other thing I want to warn you for is that I really, Tiago will talk about that. It's important to try to do isolation of your E. coli so that you can do an antibiogram sensitivity test. But you have to be very aware that E. coli is always in the intestinal tract. So when you take samples, you must avoid fecal contamination. You must also avoid, always try to take freshly dead or very sick birds, because once the birds are dead and they start decaying, then E. coli will escape from the intestine to the organs. And if you are going to isolate from there, this is not maybe the E. coli that is responsible for your clinical picture. So we will talk about sampling tomorrow, and then we will also talk about characterization of the strains to know which E. coli you are dealing with. But very important, important to investigate your E. coli strain, but even more important in many cases is to find the primary infection against that you are dealing with in the flock. So as a conclusion, E. coli a very important disease with many different pictures. They are dependent on the clinical picture that we see is dependent on the virulence factors of the strains, of the immune response of the host, of the bird, the chicken, and of all the other things in the environment that can trigger or can enhance colibacillosis. And of course, all these co-infections, viruses, mycoplasma, it can even fungus can be contributing. So diagnosis is very important. Try to find all involved pathogens and also other factors that play a role to solve your problem. And then on the last day, we will come to have a look at how can we prevent, control colibacillosis. Again, we will have to look at all the factors involved, diseases, and luckily we have a lot of vaccines that we can use, but we will have to make a good plan to make the right choice of vaccines. And then management in the farm, the breeder farm, the broiler farm, the layer farm, but also in the hatchery plays a role in avoiding colibacillosis. So that was my talk for today. So I hope you enjoyed it. And I hope you have some questions for me.
Thank you, Hilda, for your nice presentation. We do have some questions here on the chat. I will try to cover everything that it's here. And at the end, if someone else has any question, I think they can do it directly as well. So the first one is asking if there is any typical pathognomonical clinical signs that dictate infection as a result of E. coli. I think you've shown that already throughout the presentation. Want to do any comments?
Yes, I think pathognomonic, the only one could be maybe the granulomatosis, but most others can. The fact that there's a lot of inflammation and so on is a sign, but not really pathognomonic lesions. No, I wouldn't say so.
Okay.
So you have to investigate. If you have E. coli, it's not that easy.
Typical, you would say that you have a couple. Typical signs, I mean, instead of clinical, of pathognomonical.
Well, the typical sign is the very heavy inflammation. You get these thick layers of exudate. The omphalitis, but there also other pathogens can be involved. You have the acute, you have the chronic form. So yeah, I think I gave you an overview of a lot of things. Yeah. I cannot say, okay, this is no. Yeah.
Okay. Okay, another one. How would you differentiate salmonellosis and colibacillosis in broilers?
Differentiate E. coli from mycoplasma, or
salmonellosis, so salmonella from colibacillosis.
Salmonella, depending on which one, the only one that can, the ones that affect the birds are Pilorum gallinarum. They can have an effect in the smaller, the day-old chicks. But it's a different picture of colibacillosis. It's more diarrhea, enteric, whereas colibacillosis is the typical naval infection, then later respiratory. And of course, the other salmonellas, Enteriditis diffimurium, are zoonotic. So they are harmful for people, but in fact, they do not harm the chicken a lot. It doesn't make them sick. Yeah.
Okay.
We'll talk about salmonella beginning of November.
Okay. And can a regular increase of feeds predispose to egg peritonitis?
Well, the question is not very clear, but what I think is what you mean is that configuration of the hen, when she is brought in too late, can have an effect. If you have too much fat, it can have a negative effect on the occurrence of egg peritonitis. If the feed is not, the feed is not following up or not giving the hen the right nutrition, this will also have an effect. But mainly, I think it's when you look at how will you judge if the hens are ready to go in lay, you look at the ovaries, of course, yeah, you need ovaries to make eggs, but you also look at the liver and the amount of fat that there is in the abdomen. So according to that, there is an influence of the feed, but I don't really.
Okay.
I hope that answers your question.
Me too. Okay, another one asking about veterinary antibiograms. I think we'll cover that tomorrow, so I think I'll leave this one for tomorrow. Mm-hmm. Does E. coli have any importance in gastrointestinal digestion and absorption?
Well, the ones we were talking about, not really. We don't have diarrhea or from Colibacillosis in chickens. I think they might interfere with the intestinal community, but I wouldn't say that they are the reason for diarrhea, or like we see in other species, that they can affect absorption and digestion. I don't think that's the case for the pathogenic E. coli in poultry.
Okay. Okay, thank you very much. Another one. Can you clarify about Yajar's disease as a syndrome of E. coli? I think this is coli granulomatosis.
Yes.
Yeah.
That is the Yajar's disease is the same as coli granulomatosis, the disease that looks a little bit like Marek, but it's a finding not often, and morbidity is low. So you will not have, maybe you can see it a little bit more in older birds. If you have hobby flocks, maybe more there than, but not for industrial poultry. I wouldn't say this is an important disease.
Okay. Considering the virulence factors as a biomarker, can we have a rapid test for diagnosing colibacillosis that can be applied at field level?
Well, Tiago is going to talk about that tomorrow. But the virulence factors, it's important to identify them. And there are tests now that PCRs that you can do. But I think this is not directly tests that will be done in the field. It will be to see maybe some epidemiological situation, maybe to see which kind of E. coli serotypes or virulence factors can be important to add in vaccines, for example. But rapid tests, if you can do simple bacteriology, but I don't want to steal Tiago's talk for tomorrow, but E. coli is one of the bacteria that you can quite easily grow and where you can do quite easily an antibiogram. Of course, you need a minimal of equipment in your lab, but it's really one of the easiest ones to do.
Okay, another one. Are rodents carriers of E. coli?
Yes.
Yeah. On some occasions, I have encountered large granulomatosis masses in the oviduct of layers, accompanied by large amounts of serous fluid intraperitoneal. Would that be due to E. coli?
I very much think that you can find E. coli there. As I mentioned, in those cases, the most prevalent bacteria is E. coli. But of course, you also have others. You have Calibacterium manatis, you have Pasteurella that can give similar lesions. But very often it will be E. coli that you find there. But that doesn't mean that it's the primary agent. It can, because we have some virulent strains of E. coli that can cause this, but it can also be secondary to other infections that can cause harm to the respiratory, to the reproductive tract. Let's think, there's a lot of them that both affect respiratory and the reproductive tract. TRT, infectious bronchitis, yeah, even NCD. So avian influenza, a lot of them go together. So you always have to do a good investigation.
Okay, thank you very much. Another one, can you suggest that a flock that has not been vaccinated against E. coli can be free from infection provided there is a good biosecurity? So if you can have a flock that is free from E. coli just by having a good biosecurity?
I think biosecurity is important, not only for E. coli, but for all diseases. But as I said, E. coli is a normal inhabitant of the intestinal tract. E. coli is very present in the environment. So when you have a chicken, you have a chance for colibacillosis. So if you have a vaccine, I would definitely advise you to use it. I'm not saying that your biosecurity, yes, but plus vaccination.
Okay. If there is air sac inflammation in absence of other systems or parts infection, can we differentiate E. coli and Mycoplasma infection? So if there's any, yeah. Did you understood? No.
Yes. So you mean if you have air saculitis in absence of other organs affected?
Yeah.
Can you make a difference between E. coli and Mycoplasma?
Yes.
On the lesions, I would say Mycoplasma alone will not give you a very important inflammation. E. coli will. A lot more inflammation, exudate, etc. But the thing is, in real life, they very often come together. You first have the Mycoplasma that is doing a more chronic, insidious work, no acute disease. And then E. coli will take the opportunity to... How can you differentiate? For Mycoplasma, E. coli, you can easily grow in the lab. You can do a culture. For Mycoplasma, that is much more difficult. You would need to do PCR or maybe serology to identify. Right?
Okay, all right. How do you differentiate between CRD caused by E. coli or by Mycoplasma, for instance?
Well, CRD, you mean...
the complex respiratory. Yeah.
Yes, well, that's what I think Thiago will also explain tomorrow. If you have a case, then you have to make a plan, diagnostic plan, to come to the bottom of the thing. So it can be, and most probably, and usually it is co-infections. But so you have to include a wide range of pathogens in your differential diagnosis.
Okay. When is the best time to vaccinate against E. coli?
Well, in the breeders, it depends what is your target. But vaccination is usually done during rearing in breeders or laying birds with more than one vaccine, whereas in the broilers, the sooner the better, because you only have a small, they only live 6 weeks or a little bit more. But in broilers, it's a different story. Then you have to vaccinate as soon as you can. But on the last day, we will also elaborate on that.
Cover that, yeah. Is there always E. coli complications in mycoplasmosis? I think we'll cover that as well just now, but I don't know if you want to.
Well, if you have mycoplasma, E. coli is there, and if it gets a chance by stress, by other triggers, by other viruses, it will definitely give you trouble.
Okay. Is it advisable to use gentamicin to control E. coli on birds in production? Is gentamicin, or does gentamicin have negative effects when birds are under production?
Gentamicin hasn't been used, but I presume you have it available. We haven't used that for many, many years. You have to be careful. You need to know if there is, well, try to do a sensitivity test. And then also look at the withdrawal time. No, not very familiar with gentamicin, I have to say.
Okay. Can E. coli cause prolapse in layers?
Well, it will probably be the other way around. If you have prolapse, then E. coli will have, remember we said ascending infection coming from the cloaca. So if you have a prolapse, it will be more easy for the E. coli to ascend. But I don't think E. coli is the reason for the prolapse. I would think it's more the other way around.
Yeah. Which 4 diseases predispose to colibacillosis comorbidity?
Well, there's a lot of them, and it's not 4, I think. Yeah. One of them is definitely mycoplasma, then viral infections. Almost all of all the ones that affect your respiratory or your reproductive tract can be deteriorate or provoke colibacillosis.
Yeah. At what age would you suspect colibacillosis associated with lameness in commercial broilers?
I would think that this will be more after 3-4 weeks, like most lameness. It's just because then the birds become more heavy. There's more pressure on the joints, and if for some reason you have the E. coli is getting to the joints, because it's a virulent strain or there's another infection, I would say that would be the age.
Okay. Okay, another one maybe. How can we differentiate between ascites and E. coli?
In ascites, you will have a lot more liquids. The exudate in E. coli is not so, it is thick. It's a whitish thick. Ascites is more fluid and it's yellow.
Okay. Yeah, I'm just going over the questions to see which ones were already answered. Would you recommend vaccination after recovery of E. coli?
I would say that no. Vaccination is a preventive. So I would say make a plan before.
If the bird recovering, if the birds recover from colibacillosis, do they acquire lifelong immunity against it? Is it recommended to vaccinate birds that recovered? So that you answered already that part, but maybe the first one.
No, they do develop immunity, but
Yeah.
what we see is that you get recurrent. Remember I said it's not usually not one strain. In the farm, there are many strains. So your immunity is maybe not completely homologous. So, okay, immunity against this strain, but then there's another strain which is maybe not, the immunity is not there. Yeah.
Yeah, just a last one to finalize. It's exactly on that, if the vaccination offers cross protection or not between strains.
Well, there will be some basic protection, and when people or companies develop a vaccine, they will make sure that they have the most prevalent strains there. But that's why I also think that vaccine companies are continuously taking samples, doing epidemiological studies to see if their vaccine strain is still adequate. But they put in the most prevalent one. So the chances are that you have coverage, maybe not completely, but for most of the strains.
Okay. Okay, I think that is all. There were some questions on treatment and so on, but I think we'll cover that on the third
We'll come
day.
back to that on Thursday, and tomorrow, Thiago will...
Tomorrow, diagnosis. So, okay, I hope you liked it and it was valuable for you all. And we'll see you tomorrow at the same time.
Okay, see you, and tomorrow it will be Thiago.
Yeah.
Good afternoon.
Bye-bye.